Hi everyone, today I wanted to talk to you about talk therapy for obsessive compulsive disorder and how effective it is. When I talk to my clients, I find a lot of the time they have already been to a psychiatrist or a psychologist, and a lot of the time they use talk therapy as their main tool in helping the person get over OCD. In my experience, this is not very effective, and today I just wanted to talk to you about what I see and how I view talk therapy. And this is not to discredit anybody or kind of say that this is wrong and this is right. This is only my opinion, and my opinion based on my own experience overcoming OCD as well as helping other people overcome OCD. So take it for what you will, right? But generally, I don't find it to be effective. And especially when people are doing, or when a therapist is doing it as the only means to overcoming OCD. It does have its place when it comes to the therapist starting getting to know the person, understanding the person, um, trying to feel what they're feeling. All of this has its place, but I find that talk therapy it benefits the person only in a way of having an outlet, somebody to kind of to tell somebody how they're feeling, and this is extremely important. I understand that, but it's not helpful in recovery that much because when it comes to OCD recovery, it's more of a coaching situation rather than let's talk about how bad the situation is. We know how bad, when I talk to my clients, I know how bad the situation is. I can finish my clients' sentences half the time, if not all the time, um, because I've been there myself. But if you are helping a person overcome OCD, you need to give them a strategy of recovery. It needs to be action oriented work rather than like passive. So, and I find that talk therapy, where you go over the thought and, about how you were feeling, it has its place, but there needs to be a very strong action plan of how you are going to overcome this, because the goal is not to discuss the thought. That's reassurance most of the time, right? The goal is to get over the thought so you don't have it anymore, so you're not suffering anymore. So it's a goal oriented situation, and the program needs to be goal oriented rather than talk oriented. I find that every time the person has talked to somebody about OCD, especially someone they're hiring and they're paying, they need to get something out of it. So they need to say, okay, well, you know what? I got my questions answered. I know what I need to do. I'm very clear on what's happening. I'm very clear on things like that, rather than, well, I just talked about how bad I'm feeling and that's it. And like I said, it's not bad to talk about it because a person does need an outlet. And I do think that it is part of the therapist's job to be that support. But it's not about the support as much as about helping person so they don't need the support. Do you know what I mean? You need to show them how to overcome the situation so they don't need to be worrying about it and crying about it and being upset about it. So that goes away rather than just supporting them. There is a difference between a recovery program and a support program. Because when you're saying you're supporting somebody, you're not necessarily helping them recover. But when it's a recovery program, it's a goal-oriented program. So I would say that if you are talking to a therapist, like everything right now is expensive, and you are investing your time, you are investing your money into these people, and you want to make sure that you're getting out of it. There's a lot of good therapists out there. But there's a lot of bad therapists out there. So don't feel shy. If you feel like you are not receiving the help you need, moreover, if you feel like the therapist is giving you reassurance, and I mean, if they give you reassurance once, that can happen, right? But if your entire session after session after session, is nothing but reassurance, obviously your therapist doesn't know what they're doing. So pull back from that. Try to go to somebody else. You're not married to this person. Go to somebody else, see how they're gonna do, see what they're gonna say, and go around. And because whenever you talk to different people, you gain information. So you gain perspective, you gain information, because maybe one person doesn't know anything about OCD, but just gives you some sort of a like knowledge about something else that can have an effect on your OCD as well. So don't think if you're in a situation it's a total waste. It's never a total waste. But I mean, in my opinion, if you're doing nothing but talk therapy, you can't see. This is the thing: is the bottom line. You cannot recover only doing talk therapy. And I guess maybe I should have started with that, because talk therapy, you're talking about how you're feeling, but you're not discussing why you're feeling that way, and you're not discussing what's making you uh, have these feelings come back again and again. So it's more like, well, let's dig into your childhood, see if there's a reason why. And I mean, OCD is varied and the obsessions change. So maybe something did trigger you in your childhood, and then you're gonna grow up and then something else is gonna trigger you. Like I see all the time that people who are like in their teen years, they're worried about like teenage issues, right? And then they grow up, they have families, they're worried about family issues. They get good careers, they're worried about career issues. So the OCD obsessions change as the person's circumstances change. So digging into one specific circumstance and digging into one specific obsession, I mean, it's going to give you insight, but it's not going to help you overcome OCD in the full of it. Like, it's that alone is not going to help you overcome OCD. So just some people were asking me about talk therapy and what I think, so I just thought I'd share that with you. If you guys have any more questions, you can always email me at info@youhaveocd.com. I also have a website called youhaveocd.com, which has ebooks, recovery program with me, as you probably already know, and some free information as well, so please check that out. Thank you so much for watching, and I'll see you in the next video.